years is how does management of diabetes kind of interact with my care of somebody's depression? How do I help someone navigate their mobility issues as part of our therapy? So integrating management of chronic conditions, pain, sleep problems is a really great part of your practice to think about delving into. And we're going to cover a little bit of that today, but that's been a great piece to add. And then I've used that information to work with other clients too. Knowing how to manage chronic pain, sleep, some of these health issues has really benefited my practice. And about a third of our older adults, 65 and older, would qualify for some kind of disability. So with accommodations, they can still do their normal activities. I think that's an important piece for us to track, but we need to recognize it does come with those accommodations and support, because a good number of these folks will have some kind of disability as they get older. There are some cognitive changes with age. We're going to do a detailed dive on that in just a minute. And there is an increased risk of dementia with age. So we will talk about dementia. Another thing that's tricky about PTSD, which is true for a lot of disorders, but PTSD can be very on and off depending on whether somebody's in a stage of life where they're more symptomatic or they've been triggered, they're, if they've got coping strategies or not. So the symptoms really wax and wane across the lifespan, so it can be hard to get a good, clear picture of how PTSD and aging interact. We do see when we have older adults who have a clear PTSD diagnosis, they do tend to have earlier death and more complications and disability. They're also a group that tends to underreport PTSD. Again, this is if we think about people in their 70s, their 80s, so they were growing up, in the early 1900s, early to mid 1900s. PTSD wasn't even a diagnosis then. People thought of it, if they thought of it at all, it was something related to combat. It wasn't something other people experienced. Certainly things like sexual abuse, child neglect was not something. When we get to delirium, which we're talking about now, but the comment came in that urinary tract infections, when we talked about things that can affect cognitive functioning, any kind of infection is one of the things that would also, I would put that under medical conditions that can affect cognitive functioning. And that's one of the first things in a nursing home. If somebody seems cognitively different, one of the first things they're going to do is check their urine. So let's talk about delirium. A very common condition in older adults for many reasons. And it's actually a medical condition that needs medical treatment. But as mental health professionals, we may be the one who detects it. And it's going to be important to help our client and their families navigate if delirium is something the older adult is experiencing. So delirium is a condition that affects cognitive functioning, different than dementia in that it is usually transient. It usually is fixable. It's a medical condition that improves with treatment. All these medications really still need to be on here, and are any of them possibly causing some of the side effects or anything? I mentioned older adults may benefit from lower doses, and we need to be especially careful with those antipsychotic medications. We have that FDA black box warning for some of those. All right, that's a lot of information, so I'll just leave it for a moment. Certainly happy to answer questions. And one of the things I talk to my clients about is really speaking up with their doctors. Like, do I need this medication? Are we sure it's still helping? Can I try going off it and see how that does? And then look, especially if you have a client who goes in and out of a hospital. This happened all the time when I worked in the nursing home. They would go to the hospital, their medicines would all get stopped, they'd come back and it would all be a mess, and they'd be really symptomatic and confused, and or a medication would get added, and that they call it doing a med rec, a medication reconciliation. It needs to be done like every time they interact with a medical professional. Like, is everything right? Are you still taking all